So here are some guides on how to stay healthy at home during the COVID-19 lockdown. COVID-19 pandemic means that many of us are staying at home and doing less in terms of social interactions and exercise. This can have a negative effect on your physical and mental health. There are a number of advice that can help you and your family stay healthy at home during this period of confinement. Let's talk about the first one. Now let's talk about physical activity. COVID-19 pandemic means that many of us are staying at home and sitting down more than we usually do. It's hard for a lot of us to do the sort of exercise we normally do. It's even harder for people who don't usually do a lot of physical exercise. Remember, just taking a short break from sitting by doing 3 to 4 minutes of light intensity physical movement such as walking, stretching, doing chores, making the bed, and all of these will help ease your muscle and improve blood circulation and muscle activity. All adults should do at least 150 minutes of moderate intensity physical activity throughout the week, or at least 75 minutes of vigorous intensity physical activity throughout the week. For additional health benefits, adults should also increase moderate intensity physical activity to 300 minutes per week or equivalent. So here are some moderate intensity physical activities. And now, let's move on to the next health tip, which is having a healthy diet. Eating a healthy diet is very important during the COVID-19 pandemic. What we eat and drink can affect our body's ability to prevent, fight, and recover from infections. While no foods or dietary supplements can prevent or cure COVID-19 infection, healthy diets are important for supporting immune systems. Good nutrition can also reduce the likelihood of developing other health problems, including obesity, heart disease, diabetes, and some types of cancer. Avoid touching your eyes, nose, and mouth with unwashed hands. So here are some tips for maintaining a healthy diet. First is eat a variety of food, including fruits and vegetables. Next is cut back on salt. Next, eat moderate amounts of fats and oils. Next is limit sugar intake. Next is stay hydrated or drink enough water. And lastly, avoid hazardous and harmful alcohol use. There is no evidence that COVID-19 can be spread through the contact with food or food packaging. COVID-19 is generally thought to be spread from person to person. However, it's always important to practice good hygiene when handling food to prevent any foodborne illnesses. Here are some 5 keys to safer food. First is keep the food clean. Next is separate raw and cooked food. Next is cook the food thoroughly. Fourth is keep food at safe temperatures. And lastly, use safe water and raw materials. And for the last and next health tip, let's talk about mental health. As countries introduce measures to restrict movement as part of the efforts to reduce the number of people affected with COVID-19, more and more of us are making huge changes to our daily routines. The new realities of working from home, temporary unemployment, homeschooling of children, and lack of physical contact with other family members, friends, and colleagues take time to get used to. Adapting to lifestyle changes such as these and managing the fear of contracting the virus and worry about people close to us who are particularly vulnerable are challenging for all of us. They can be particularly difficult for people with mental health conditions. Here are some tips and advice that we hope you will find useful. First is keep informed. Listen to advice and recommendations from your national and local authorities. Follow trusted channels such as local and national TV and radio. And keep up to date with the latest news from WHO on social media. Have a routine. Keep up with daily routines as far as possible or make new ones. Minimize news feeds. Try to reduce how much you watch, read, or listen to news that makes you feel anxious or distressed. Social contact is important. If your movements are restricted, keep in regular contact with people close to you by telephone and online channels. Alcohol and drug use. Limit the amount of alcohol you drink or don't drink alcohol at all. Don't start drinking alcohol if you have not drinking alcohol before. Avoid using alcohol and drugs as a way of dealing with fear, anxiety, boredom, and social isolation. Screen time. Be aware of how much time you spend in front of screen every day. Make sure you take regular breaks from on-screen activities. Video games. While video games can be a way to relax, it can be tempting to spend much more time on them than usual and at home for long periods. Social media. Use your social media accounts to promote positive and hopeful stories. Correct misinformation whenever you see it. Help others. If you are able to, offer support to people in your community who may need it, such as helping them with food and shopping. Support health workers. Take opportunities online or through your community to thank your country's healthcare workers and all those working to respond to COVID-19. And lastly, don't discriminate. Fear is a normal reaction in situations of uncertainty, but sometimes fear is expressed in ways which are hurtful to others. So those are the tips on how to stay healthy at home during COVID-19 lockdown. Thank you for listening and watching.